My name is Stanley Zumuka. I want to show around my room, my circle there. Alright, so the skills I'm performing today is nasogastric tube insertion and discontinuation. So I'll start first with nasogastric tube insertion, then at the end of it I'll continue with discontinuation. So to begin with, I'll go ahead and wash my hands and look at the doctor's order and making sure that I'm dealing with the right patient and I'm carrying out the right procedure, which is nasogastric tube insertion. Okay, after doing that, I'll come into the patient's room. After taking out my stuff and coming to the patient's room, here are my appliances right here. I'll be naming them as I go along. And this is my patient right here, and this is the patient's head. I'll explain to the patient my procedure and what I will be doing. So I'll bring the patient's bed up, tilt it to a semi-folded position, then check the band on the patient's hand and check out the computer to make sure I'm dealing with the right patient. I will want to put the drip field underneath the patient. And right here, if you see these two syringes, I just put it for representation of the two nostrils of my patient. Right, then I will go ahead and put, this is my MSing basin that I'll be using. Right then, go ahead and put on my gloves. And the reason we are performing this skill is because our patient was diagnosed with a soft bowel obstruction, a small bowel obstruction. So that's the reason he needs an NG tube insertion. So after putting on my gloves, I'll go ahead and open my saline sump, which is right here. Put in my saline sump. So I want to make sure my saline sump is clamped. Go ahead and clamp my tube. After clamping my tube, I will now go to my patient. I'll measure from the earlobe of my patient to the nose and down to the xiphoid process. So is the earlobe right here, right to the, from the earlobe right to the nostril, and I'll hold it right there and down to the xiphoid process. Then I'll want to put a little tape to just mark the area. I also want to coil the tube and put in ice water so to permit it to easily penetrate down into the patient's stomach. So after doing that, I will then go ahead and take my lubricant, open my lubricant, put my lubricant on the stuff and lubricate the tip of my tube. Grab the tube. I also want to test the nostril of my patient to making sure that I am inserting the tube at the nostrils where the patient has good breathing. So I've tested and it shows that the left nostril is the best to insert. So I want to tilt the patient head backward and look into the nostril to make sure that there are no blockages. There are no blockages along the way. While I then tilt the patient head backward and insert my tube. And when the tube has just gone past the oral pharynx, I will stop and hold my tube right there. Then and give my patient a cup of water with a straw and ask my patient to take a sip of water. And as they take a sip of water, I will tilt their head forward and continue to insert the tube. So I'll tell them take a sip of water. As they take a sip of water, I tilt their head forward and now I continue to insert my tube downward. I insert my tube, take a sip of water, take a sip of water, take a sip of water. Okay, when my tube must have reached my point where I marked, I will then stop. When I stop now, I take my pen light. I'll take my pen light. As I take my pen light, I will then open my patient's mouth and look to see if there were any coiling in the patient's mouth. I can see that there are no coiling. I'll put it right there. Then I'll then grab my tape. I'll tape it to the patient's nose here. I'll tape the tube to the patient's nose, and I also want to make a little tape on the patient's show dress right here to hold the tube in place, but making sure that the patient can be able to relax, to turn their neck without any problems, without removing the tube. So I make sure the tube is all relaxed. Okay, after doing that, I want to send the patients down for placement, and the best means for placement is by x-ray. And after either send the patients for x-ray, or I can also do a testing by using my piston and test the aspirant, take out an aspirant and then test with my tube, with my PS strip. So to do that, I will take this off. I'll first of all want to clamp. I'll clamp at the bottom. Then I'll take this off. Then I'll put my tube right there. Pull up, allow it pull on my aspirant. So put on my aspirant. I'll clamp it back. Take this off, and then I clamp my tube. Then I'll put my aspirant right in there and read the figure that it gives on my PS strip. I'll put this right in back there. Okay. After I must have done that, I will then want to connect my patient to the suction machine. So this is my suction machine right here. I want to put my suction machine on, and as I put my suction machine on, I will clamp my tube. I clamp my tube at the bottom. I'll take this off. Take my suction machine and connect it to the tube. Okay, when that has been done, I'll now observe for what is coming out from the tube. I'll also want to observe the color that is coming out of the tube. So, and how much is filled in the suction machine. So after I must have done that, I will then want to, because when the patient is placed on suction, the tube in the stomach can be displaced to the side. So I want to use my piston. I'll use my piston. I'll put in air, about 5 milliliters of air, in order to push the tube into the stomach from the side. I will then take this blue section of the tube. I will want to take this off. Take this off by clamping it at the bottom. Put it, allow it there. Send in my air. Clamp it back. Take this off. Take my tube in here. Clamp it back. So that is it. And after that has been done, I will then go ahead and reassess my patient. Check again with bowel sounds. Clear my stuff all around the patient. Reassess my patient, making sure that they tolerated the procedure. And I can come back after 30 minutes to reassess them, how they are doing, and to see if there are any changes from my first assessment. So that is it for the nasogastric tube insertion. So I'll just go ahead and continue with removal of the tube. So for removal of the tube, I want to check on the doctor's order, making sure it's the right patient, check on what I need to do, check on, after doing that, I get my appliances. For my appliances, I'll be using a drawer, a dripping sheet, which is right here. I'll be using my syringe, which is right there, to draw my water. Then I'll be using my paper towel. So those are the three appliances I'll bring in. So after explaining the procedure to my patient, I'll bring up their bed, put their bed in a comfortable position, tilt the bed at the semi-fold, put the patient at the semi-fold position. Then I'll want to go ahead and put a dripping field right underneath the patient, right there. After putting my dripping field, all right, I'll go ahead and stop. After explaining everything, I'll stop my machine. Go ahead, I'll clamp it at the bottom, take out this tube and clamp it right there. After that has been done, I will now want to put on my gloves. Right, then I'll draw up 20 milliliters of water in my syringe, and also 20 milliliters of air, making it 40 milliliters of water and air, making sure my water is at the bottom, while my 20 milliliters of water at the bottom, while the 20 milliliters of air is at the top. Put my syringe right there. Then I'll then take my syringe to my patient and I will clamp the bottom of the tube. I'll take this off, put my 20 milliliters water and air, allow it, push it in, down, clamp it at the bottom back, take it off, clamp the top. Then when that has been done, then I'll then go ahead, I'll put my patient's paper towel right closer to them. Then I'll tell them that with the count of 3, they will take in a deep breath and hold while I pull off the tube. So I'll go ahead and take out all the tapes. Take out all the tapes. Take out the tapes from the dress. After that has been done, I'll then tell the patient, okay, I'll go ahead and count 1, 2, 3. As I take a breath, go ahead and pull it really fast and then wrap it in the paper cloth here. I wrap it, take it off and give my patient their paper towel to clean their nose. So I'll go ahead and take this off, take my gloves off and wash my hands. Then I'll wash my hands, reassess my patient. After I reassess my patient, I check for bowel sounds, check for hardiness, check for any inconvenience or how they tolerated the process. Then I will then go ahead and chart, bring down the patient's bed to comfortable position and give them their call light. Then after 30 minutes, I'll come back and reassess the patient, whether they can tolerate water, they can tolerate ice, or any liquid that has been prescribed for them, see if they tolerated it. Then I do all my charting. I think that's it for nasogastric tube discontinuation.